Well, happy Global Clinical Engineering Day, everybody. And I've got Zheng Alan with us on the line today, and so happy to hear from him. So Alan, tell us about your job in Hangzhou.
Okay, thank you, Tom. And currently I work as the Director of Logistical Support Service Department, which includes clinical engineering, facility engineering, construction engineering, and dietary department at Children's Hospital of the Zheng University School of Medicine. I have been already working in the clinical engineering field for 35 years and was the first clinical engineer in the hospital ever since 1985. The clinical engineering department at my hospital is among the first clinical engineering departments in China. I participate and witness the development, the ups and downs of clinical engineering in China. I worked with experts such as Bob Morris, George Johnston, and Professor Herman Wei, and many others from Project Hope back in 80s and early 90s, when the NICU at my hospital, the first NICU in China, which was a collaborated program between my hospital and Project Hope. Currently, there are 25 staff in the clinical engineering department at my hospital, and they are responsible for medical device technology management. Thank you.
Wow, what a cool history. So tell us about clinical engineering in China. I know you're one of the leaders of the National Society.
Yes, and Chinese Medical Association and Clinical Engineering, also called CSCE, Chinese Society of Clinical Engineering, was formerly a medical instrument professional committee affiliated to the China Biomedical Engineering Society. On October 11, 1993, Chinese Medical Association and Clinical Engineering, also we call it CSCE, is formally established. One of the main missions of the society is to carry out academic and technical exchanges at home and abroad. Ever since its establishment, the society develops very quickly. From early time, there were only 6 provinces established the clinical engineering chapter of Medical Association at province level. And now about 29 provinces from 2 to 31 provinces in mainland China have established the clinical engineering chapter of Medical Association. Thanks to the efforts of the Chinese clinical engineering community, as well as global C leaders such as Yatin David, Tom Judd, Vincent Wang, Angeli Anna, and many others, their strong support and assistance, great progress has been made in Chinese clinical engineering. According to several surveys, there are now about 100,000 clinical engineering professionals working in hospitals in China. There are several related professional associations in China now, yet CSCE, the Chinese Society of Clinical Engineering, is still the main clinical engineering professional association. CCCE, Chinese College of Clinical Engineers, and the CAME, Chinese Association of Medical Equipment, are other 2 top clinical engineering relevant organizations. Thank you, Tom.
Well, actually, I said you're one of the key leaders, and you are, but you're what? The president or the vice president?
I personally, I'm the Secretary General of the CSC and also the Vice Chairman of CCCE.
Wow. So tell us about the clinical engineering response in China to COVID-19.
Yeah, in fighting the COVID-19, CSCE tries efforts to make full use of its platform, carries out epidemic prevention and control, ensures material support with focus on decision consultation, information support, and technical service. We also organized or co-organized several webinars with our overseas peers, such as IFMB-CED, which is your organization, and ACCE, AMI, and the related organizations of South Africa and South Asia. And all clinical engineering professionals are working through rigid shifts, 7 days a week, 24 hours a day, around the clock, and racing against time to ensure the installation and commissioning and maintenance of the relevant medical equipment, preparing the PPEs, etc. in their hospitals. In the face of the epidemic, they have always been stationed in hospitals and become the patron saint of medical equipment. Take my home province, Zhejiang province, as an example. There are 10 clinical engineers went to Wuhan back in the early February to support combating the COVID-19 there in frontline, and their contributions are highly recognized. Thank you.
Well, in the midst of both suffering, but all this great development, what's your vision for the future of clinical engineering in China?
The in-house clinical engineering is developed very rapidly these years. I observed several interesting phenomena. The first, led by CSC and CCC, Chinese C community networks and communicates very actively and frequently, both at local and international level, share best clinical engineering practice, and learn each other. The second, more and more C departments now in China adopt cloud-based and mobile devices assisted CMMS to manage medical equipment technology life cycle. The third, more and more in-house clinical engineering professionals are engaging in scientific research, technical innovations, and working on many projects to help their facilities to solve frontline problems on site. In my perspective, the future of clinical engineering is very good and bright. At artificial intelligence, the thing of net, virtual, or enhanced reality, emergency preparedness are some keywords in terms of the future of clinical engineering. Thank you.
So Alan, last question as we conclude. So you and Li Bin and others led an incredible team to Rome. I think over 30 of you and your colleagues with an incredibly strong participation in our last Congress. And of course, you were the host of our first Congress there in Hangzhou.
In 2015.
When we began Global CE Day, you were there.
Yeah. Sure.
And then, of course, Sao Paulo and Rome. But we're expecting many of your colleagues to join you in Orlando a year from now, and looking forward to those abstracts. And thanks for such great support of clinical engineering worldwide.
Yeah, and we're looking forward to it. And one thing for sure is currently we are organized. We circulate the news. And we encourage the clinical engineers and technicians. They write the paper abstracts and urge them to submit on time. Of course, we also hope if the pandemic is controlled very well, next year we can have the chance to be presented, to be attended a meeting in Orlando, in Florida, in USA, right?
Okay, Alan, see you at Disney World then. Yeah. Thank you. Thank you for your time.
You're welcome. My pleasure. Thank you.
Bye for now.
Bye for now. Thank you.